Hello, this is Jonathan Wright, Dr. Wright again, for another one of our presentations. Well, tonight's has to do with cutting risk of cardiovascular disease, usually includes heart attack and stroke, to zero or close. Wow, what a claim! I know, but after you hear about the research that tells us that this is possible, and I'll also tell you about where you can look the research up with, citations, footnotes, go online, see what you can find. I'll tell you where you can find it too. I'm just not making this up, folks. All right, there are two basic approaches. Let's cover the first one first. Is research that started all the way back in 1976. No kidding. It was started in Finland, which is a small country in Europe, but not at all third world. It's considered one of the industrialized nations. At that time, Finland had a population of some 3.6 or 7 million, which was actually less than the population of New York City. But even so, there they were in Finland, that many people. What did they decide to do? Well, I guess with a small country like that, you can run this sort of experiment. They decided to do a nationwide study on cardiovascular disease and could it be prevented? And that study ran for 30 years. No kidding! 1976 through 2006, when the final report of which I'm aware came out from some professors there in Finland. So what did they decide to do? What can you do with a whole country? Well, of course, you can get into everybody's medical records if it's socialized medicine, and it has been in Finland for a long, long time. So they can keep track of everybody. And besides that, it's a small country. So they went on a campaign, a public health campaign, to try to convince everybody of two basic approaches, just two. One, you've heard this before. Eat less saturated fat, more unsaturated fatty acids, please, in our diets. Okay, that's one approach. What's the second thing? Throughout Finland, everybody is going to use a certain kind of salt. Now, when we think of salt here, we usually think of sodium chloride. But my goodness, ask any chemist. There are all kinds of different salts. And what they used in Finland was a combination of magnesium chloride. Keep in mind, magnesium is said to be the #1 mineral for cardiovascular health. Not the only, but the #1. Combination of magnesium chloride, potassium chloride, a tiny bit of sodium chloride, a little bit of lysine, which Linus Pauling said is good for everybody's hearts. And that was used throughout Finland. In fact, everybody had a really hard time getting their fingers on sodium chloride. They couldn't get it anymore. Not just in people's homes was it used. It was used in their restaurants. It was used in the hospitals. It was used everywhere. If we're going to use salt, we use this particular type of salt. All right, those are the two things that were their clinical, or I should say their social interventions. Everybody don't eat so much saturated fat, more unsaturated fatty acids, and by the way, use this salt all over the place. All right. That went on for 30 years. No kidding. And in the final report, they not only gave us statistics, but they gave us a good sense of humor. They said that despite the fact we have more obesity, more smoking, and more drinking in Finland before this experiment started, the rate of all those things has been going up. Despite that, there has been a 60 to 65% reduction in deaths from heart attack and stroke here in Finland. 60 to 65% reduction. Wow! Most of that was achieved in the first 20 years, but it was a little better by the 30th year. You got 45 to 50% less cardiovascular deaths 30 years later after implementing those two things. Wow, 40 to 45%. One can look this up. In some circles, it's called the Finnish Medical Miracle. But again, I'll tell you where you can find the citations and references if you want to read about this and find out if it's true. It is true. 40 to 45% less risk of dying from cardiovascular disease over 30 years' time, despite the fact that, as the professor said, we have more obesity, more smoking, and more drinking. Oh, I forgot something. The average life expectancy for men and women had increased by 6 to 8 years. The average life expectancy by that time. And I forget which one was men and which one was women, but I'm guessing the women had the greater increase, as women usually do. Wow! Now that's approach number 1. Let's go to approach number 2. 2 pieces of research there. One was done right here in our country and involved about 1,800 ladies and somewhere between 2,000 and 3,000 guys. And they were observed over a period of time, long enough to make a difference. And what they found was the ones who were blood donors. Did I say blood donors? What's that got to do with cardiovascular disease? We'll get to that. The ones who were blood donors had 45% less heart attacks and strokes and cardiovascular disease over that period of time. 45% less. With just men this time, 2,800 approximately men, observed over 9 years period of time. The ones who donated blood had 88% less heart attack and stroke. Did I say 88%? Yes, I did. You can look it up in the references that you'll be able to find once I tell you where to find them, of course. Yes, that much less. 45% in one experiment with men and women by donating blood, and 88% in the other. Now, how does that work? To understand that, we need to go back to physics, not chemistry. Now, we're usually told that cardiovascular disease is a result of systemic inflammation up and down the blood vessels. If that's the case, how come you never heard of an arm attack? Huh? Well, look, if it's systemic inflammation, there should be inflammation in the blood vessels of the arm, shouldn't there? And so why should we mostly hear about heart attacks and strokes and not arm attacks? And what about leg attacks? It's not due to systemic inflammation, cardiovascular disease. Now, I'm going to agree it's due to inflammation, but it is local inflammation. Have you ever seen a picture of a heart with the arteries and the cholesterol clog? And where's the cholesterol clog occur? At the branch points of the arteries, right? And up here in the neck, at the branch points of the carotid arteries. Cholesterol clog doesn't happen halfway down your arm. And it doesn't happen in a long blood vessel that's running straight. It happens at the branch points. Why is that? Well, a lot of this is explained in a book by a Dr. Kenneth Kensey, K-E-N-S-E-Y, called The Blood Thinner Cure. Now, it really should be titled The Thinner Blood Cure, because he's not talking about taking blood thinners. He's talking about having thinner blood. Huh? What's thinner blood? Well, let's see. If you happen to be a woman between menarche and menopause, and you don't smoke cigarettes, and you don't use birth control pills for any extended period of time, what is your risk of having a heart attack or a stroke? Approximately 0. Really close to 0. Why is that? The uterus has 2 functions. One is to develop and birth babies. That one we're all familiar with. Its second function is to keep mother alive until her kids are grown up. When did ladies first usually start having their babies? At age 30? No, it was usually in the late teens and early 20s. Okay, it takes a child 18 to 20 years to grow up. By the time they're grown up, the woman is 40-something, isn't she? And that's when menopause at that time was in the 40s. Not very much of it. Used to be it was average in the 50s, but still, menopause didn't happen until the kids were grown up. Well, what's that got to do with anything? Menstrual blood loss every month thins out the blood. Remember the thinner blood cure? What do you mean thins it out? Well, let's see. If you go get your blood test done at your doctor's, they'll tell you, here's your blood count. Well, what are they counting? One of the important things they're counting is the percentage of red blood cells in the total volume of blood. Now, that percentage of red blood cells makes up approximately half, it's not entirely the whole thing, but half of the thickness of the blood. Half of it. Okay. So, if you ask the laboratory what is the normal percentage of red blood cells for a menstruating woman, oh, it's between 37 and 38% and about 43%. What's the normal for a man? 45 to 50%. Significantly higher concentration of red blood cells, which means a man has thicker blood. And I know some of the ladies say us guys have got thicker heads too, but that's another story. We're talking about thicker blood here. Well, what difference does that make? Well, as Dr. Kenzie and his colleague Dr. Cho from Korea, who's a physicist, explained, atherosclerotic plaque has everything to do with physics and not with body chemistry. The physics of blood flow. If we have thicker blood flowing down a straight blood vessel or a relatively straight blood vessel or down a thick pipe, it doesn't abrade the insides of the arteries very much, does it? But if that thicker blood comes to a branch point, it causes whirls and eddies. And just imagine, you've been walking perhaps or looking from an airplane at a river, which is flowing straight. Do we see many disruptions in the current? Yeah, maybe some, but not much. What happens when that river whams into an obstruction? Let's say it's an island. What happens? Whirls, eddies, abrasion, more erosion of the banks. And that is precisely what Dr. Kenzie and Cho explain happens with thicker blood when it hits into that branch point in the carotid arteries here. It hits into a branch point here. It creates inflammation. Oh, okay. I thought it was cholesterol. No, the first step is the inflammation caused by the thicker blood. Now, let me give you another example of what our bodies do to protect against damage. Let's say we all go out in the garden and pull weeds or shovel stuff or whatever. We get calluses on our hands, don't we? Well, most of us don't have them now because we're not doing much so-called manual labor. But if you ever have had calluses, you know they go away when you quit doing that kind of work. Yeah, calluses built up the thick skin to protect against abrasion. What does the inside of an artery do? Can it make a callus if it's getting all inflamed? No. So what happens is that cholesterol is pasted over the inflamed area to protect it. And it does for a while, but if that blood continues to be thick, it creates more abrasion at the margins of that cholesterol paste. And so the body has to paste more cholesterol on. And if the blood continues to be thick for years, the cholesterol clog gets so much that the blood flow is impeded, and now we have a heart attack or a stroke. But never an arm attack, remember that, or a leg attack. Now, all right, if the blood is creating inflammation and cholesterol clog, what do we do about that? Particularly for guys, we can have menstrual periods, can we? No. Remember one other fact. After menopause, a woman's risk of having a heart attack or a stroke rises to the same level as men by age 60, 62. Gee, it took, 10, 12, 15 years for that to happen? Going from having menstrual periods and virtually no risk of heart attack to being the same as guys? Oh, by the way, if she's not losing any blood anymore, doesn't her red blood cell count go up to about the same as a man's? Sure, it does. Now I'm going to back up to something else that's very important about having menstrual periods, and that is, a woman's body has to replace that blood. It does. At least the amount lost. So a woman's body builds many more new blood cells than a man. Sure, a man's body builds new blood cells at a very slow pace, What's the average length of time that a red blood cell lives? Well, 6, 7 months, something like that. So a guy does have to replace his red blood cells, but slowly. A woman has to put out a significant proportion of new blood cells every month. What difference does that make? It's been shown over and over again that new blood cells are much more flexible than old blood cells. Just like teenagers are much more flexible and do better gymnastics than I can at my age. Yeah, much more flexible. What difference does that make? Well, pretty simply. It's well known to people who study this stuff that there are tiny capillaries in our bodies in many areas, which are so small that a red blood cell can't get through there. So how does the oxygen get delivered and how do the nutrients get delivered? Well, here comes a brand new blood cell. It can form a blood cell sandwich. It's just like plopping a donut over it forms a blood cell sandwich, and that can get through the blood cell and deliver the oxygen and the nutrients. So if women have a significantly larger percentage of new blood cells, they can literally deliver oxygen and nutrients, not on purpose, but it happens inside the body, to areas that men's blood cells have a harder time getting into, having a fewer number of these new blood cells. All of this is in the Dr. Kenneth Kenzie's book, so please don't think you have to memorize it. You can read it in the book too. So women have two advantages: less thick blood and more new blood cells. So what happens now after menopause? Ma'am, if you go donate blood at least once or twice a year, you keep the thickness of the blood down, and you can prove it by doing a blood count. Men, we have to start thinking about doing that from when we become adults if we're going to prevent those heart attacks and strokes when we're older. Really, blood donation is known to cut down the risk of heart attack and stroke. How often? Arbitrarily, I'll usually say a couple times a year, but you can, just by checking your blood count along the way, find out if that's too much for you or enough for you. And your doctor can help you with that. All right, so what happens if we put these two approaches together? The 30-year Finnish study, risk reduction of 45 to 50% in cardiovascular diseases if we then attribute the other 10 to 15% to patent medicines, which is what the professors did when they wrote the article. And remember, that was despite more obesity, more smoking, more drinking, still a 45 to 50% risk reduction attributable to less saturated fat, more unsaturated fat, and this salt stuff. If we put that together with blood donation, and as you just heard, the research shows in one a 45% risk reduction and the other an 88% risk reduction, you put those two big risk reductions together, and you're very likely to get to zero or at least close on risk if you follow both of them. Now, to put it shortly, let's see, less saturated fat usually means more fish, maybe some fish oil. Please do not be afraid of fish oil. I know there's a thing circulating around out there that it's dangerous. No. If we just make sure and take some vitamin E every day, the phenomenon called lipid peroxidation for the technically inclined, which can happen with too much unsaturated fat, it will not happen. So just use some vitamin E, maybe 400 or 500 units a day. All right, we put that together with donating blood at least a couple times a year, and you can work through your doctor to find out what is best for you. What are we shooting for? We're shooting for that hematocrit that's in the upper end of the menstruating woman's normal age, which is normal hematocrit, which is between 40 and 43. And guys, those ladies are just as healthy as we are, even though their blood is thinner. They're chasing all the kids. They're doing all the things that they need to do. They're not worn out from being anemic. No. Yes, after we donate blood, we do feel a little tired the next day, but we bounce right back from that one. So put those two things together. Don't forget the salt. That was a big part of the Finnish experiment. Now that salt is actually available. No kidding. It's available. It's exactly the same as the salt over in Finland. Unfortunately, it isn't carried to very many places. it is carried, and yes, I am the medical director at Tahoma Clinic. It is carried in the Tahoma Clinic dispensary, but if you ask your health food store for it enough, they might start to carry it too. And you can get that salt, and it's very safe to use. You just put on as much as your taste buds say is okay, and there's no way we can get into trouble with magnesium chloride salt, potassium chloride salt, and the very tiny amount of sodium chloride. It doesn't raise blood pressure. Magnesium lowers blood pressure. So again, fish oil, fish. Oh yes, we can still eat beef. Make sure, though, it's the so-called grass-fed, although the cows do feed themselves. It's not really you're feeding them. Because there's absolutely ironclad research that grass-fed, so-called, has more omega-3 fatty acids and less saturated fat. So we just have to pick which to eat, which of the beefs to eat. Fish is fine. Use the salt. All that information comes from the Finnish research. Go donate blood. That comes from the other research. Now, if this sounds too unbelievable, where do you find this information in more detail? All right, it's found in my newsletter. Imagine that. And the June issue, which hasn't come out yet, comes out first part of May. No, first part of June. I got that wrong again. Comes out first part of June. Yeah, my memory isn't totally perfect. Comes out first part of June. Details all that research. It has the footnotes to the medical journals, so you can look it up if you want to. And it also tells you about the salt and where you can obtain it. Again, it's Tahoma Clinic dispensary, but it'll tell you that in the newsletter. So the point to all of this, folks, is that we can dramatically reduce our risk of heart attack and stroke by some very simple measures. And you know what? Donating blood is good for us. Not the menstruating ladies, but after menopause and for men. Well, anyway, you've listened to me carry on for long enough. Thanks very much for watching and listening. All right, bye now.